New data is showing some good and bad news when it comes to cancer, but doctors are hopeful that it will help make more people aware about the importance of testing. Channel 8's Matthew Mittleider spoke to the experts today and has more.
With new treatments and more testing being done than ever before, experts say cancer deaths have been decreasing across the country. However, there are still some spikes in certain cancers among young people to watch out for. This year, new cancer diagnoses in the U.S. are expected to reach 2 million for the first time ever, according to the American Cancer Society. I spoke to Dr. Avery with Nebraska Hematology Oncology, who says while we don't know for sure why there's an increase, better testing has probably contributed to catching more cases.
In Lincoln, we're very fortunate because we have some of the best screening numbers in the region and really in some ways across the country. But you got to communicate with your primary care and your other providers and physicians about how to best put yourself at low risk.
He says men are being asked to start colonoscopies starting at age 45 now instead of 50 because more patients are being diagnosed with colon cancer at a younger age. Avery added that breast cancer diagnoses are also going up, so it's important to get mammograms regularly. It's suggested women start getting them at age 45 unless there's a history of breast cancer in your family. One patient says getting a mammogram is what led doctors to finding her pancreatic cancer last November.
I went for some tests in David City and they told me that I was yellow, I had jaundice, and so I went to my doctor and she said, took some blood tests and she says that you're pretty sick, we're going to get you to Lincoln. So I felt fine before, so this was a shock to find out.
She says she's glad doctors were able to catch it when they did, and that the treatments are going well so far.
They told me I can fight it, so I guess that's what I'm going to do.
The American Cancer Society says deaths from cancer have declined by over 30% since 1991. Avery and other experts with UNMC say better treatments have contributed to that decline.
We have such incredible therapies today, so many things that we can use to treat a cancer, that it's definitely not a death sentence at all.
And doctors want to remind everyone that one of the most important things you can do to safeguard against cancer is to get yourself tested regularly. Reporting in Lincoln, Matthew Mittleider, Channel 8 News.